Afternoon, everyone.
Good afternoon.
Just give it a few more seconds before we make a start. Okay, think we'll make a start, and hopefully others will join if they're able to. But we've got a fair number on the call, so thanks everybody. Thanks for joining for this edition of Question Time. And firstly, just to say Happy International Women's Day to fellow women colleagues on the call today and across the trust. So, and thanks for everything that you continue to do. I think there's few things going on. I know Liv, one of our PAs, I've seen some communications from her today. So yeah, look out. Please do look out for anything relating to that. So as always, just a few areas I wanted to pick up with you all. But please do use this opportunity, raise your hand, use the chat box. Any questions, anything that you're concerned about, please do utilise this time. And also, I don't want it just me doing the talking, really keen to hear from yourselves as well. So a few things just to start off from myself, just to touch on COVID, although I am trying as we move forward to maybe move that down the agenda a little bit, but just to say I'm just really mindful as well at the moment with the changes and restrictions easing outside of the hospital, that's quite challenging for some of our staff internally, where within the NHS things haven't changed yet or may not change considerably anyway to what we're currently doing. So just a few points really just to pull out from a COVID perspective. We still remain in a level 4 national incident, which again feels very bizarre as government and the rest of the restrictions easing. That is under review, so I'm sure imminently they'll probably downgrade it to a level 3 as they did previously after the first wave. But what that means for the trust, there are certain things that we have to have in place from a major incident planning and be able to respond really quickly to information or data requests that the trust is asked for. It also means that we are still in that, what I would say, command and control. So again, coming from the centre, information and requests for us that we need to action within some often quite tight timescales. So that's the current situation, but I do believe it's currently under review. We'll have seen COVID prevalence plateau. I'd probably use the term plateau. It hasn't decreased, I think I've raised previously, compared to some of the other waves we've seen, Omicron, compared to Delta, especially. We haven't seen the steep decline as we saw with Delta. As it went up, it went down quite significantly. So of course, alongside that still comes its operational challenges, both for us at Robert Jones, more around staff absence. So we're still seeing significant COVID absence across the trust, which makes care delivery challenging. We have to think differently, new ways of working, etc. But also across some of the district general hospitals, and certainly Shrewsbury and Telford are also having the impact on prevalence within the hospital. It is changing slightly, so it's not necessarily patients admitted to hospital because they've got COVID and they're sick with COVID. What they're seeing, and certainly the update from Shrewsbury and Telford at a meeting I was at yesterday, it's incidental findings. So it's as they're supposed to, and as we are, it's testing, and then it's finding a patient who's coming with something else and they happen to have COVID. It's good news from the fact that we're not seeing people as sick with this variant, but it's still, as I talk about operational challenges, how they're cohorted, how their care's delivered. So it is still, despite what we're seeing outside of hospitals. It's still significantly challenging. Just in relation to any IPC guidance, we've had one letter, it was almost a holding letter from the national team, basically saying that restrictions need to remain in place. So things like face masks within, for both staff and visitors within hospitals and patients, of course, where you can social distance, hand hygiene, all that at the moment remains in place. They are reviewing testing as they are reviewing it aligned with what we've heard around stepping down testing regimes. There will need to be testing for hospitals, and what that may look like may change slightly. But as I say, that's certain elements that are currently under review, and we're hoping to hear, I think April, certainly April, we should receive further guidance. Alongside that, they're also reviewing visiting guidance as well for hospitals. The team here are currently reviewing how we enabled visiting for patients previously, to see if that's still fit for purpose, to maybe enable us to move to enable patients to have visitors again within the trust. So lots of work, lots of reviews taking place currently. But as it stands, whilst you're within the hospital, we're still saying all the measures that we put in place, the distancing, face mask wearing, hand hygiene, really good cleanliness, etc., all that needs to remain in place. And of course, we, as and when we get that information, are able to digest it and work it through for us as the trust. Obviously, we'll communicate that out to yourselves as well. Which brings me on to another area of infection prevention and control. And I've spoke to some staff individually as part of when I've been doing some walkabouts, but also I've done other briefings such as managers briefing. I touched on this last week with our managers. People will be aware we had back in the summer last year an MRSA outbreak on one of our wards that did identify issues in relation to cleanliness, our estate, so some of our facilities, our environment, and also governance and some of our assurance and oversight in relation to infection control. And we did respond in relation to various different things that we put in place, reviewed some of our systems and processes, you know, had what felt at the time a good response from yourselves and from the organisation, and we have started to invest in some of the estate work. So certainly, as we'll know, Gladstone and Wrekin have currently undergone refurbishment, and so as part of Clwyd Ward as well. Disappointingly, we had a regulator visit last month, mid to end of February, which was evident really from their re-inspection that we still have areas, they still identified areas such as cleanliness, some of our governance processes that we either didn't finish following the work that we put in place, or we haven't embedded, shared it across other areas, and certainly maybe not sustained it as well as we should have done. So just as a, not to go into all the detail of some of their findings, but again, just to bring it to life a little bit. So they found issues around cleanliness, such as things like our mattresses on some of our wards, commodes they found dirty but had got "I am clean" stickers on them. They found issues around estates and some of the estates improvements, so holes in walls, rusty hinges, rusty equipment, etc. So they found issues such as that. And again, some of gaps in some of the assurance processes. So again, using an example, they found they were given action plans that they reviewed that had been closed off, but when they went to look at the area that had been closed, so for example, there was some estates work that had been closed off, but when they went to inspect, it hadn't been completed. The other thing that they picked up in the re-inspection was probably what you could call a culture, really, or maybe some cultural issues around our compliance and our importance of IPC. So things like bare below the elbows, which we know in the NHS is not a new thing at all, brought in many, many years ago. And also some of our theatre attire being worn outside of theatres. So, for example, theatre hats. So then were the sorts of areas that they picked up, and there was a long list. There was a long list of issues that they picked up on that in re-inspection back in February. So I suppose off the back of all that, I can't emphasise enough the severity of it. And I say that from a patient safety perspective. And we all know the importance of good infection prevention and control standards to protect both our patients and our staff as well. So there's significant work underway, and we're taking a positive stance around the improvements that we can make within the organisation, and to instill some pride back in the environments that we're working within. So I ask of you all, our responsibility as a senior team is to ensure we're putting resource into the improvements needed, that we will provide the training and education that's required. And again, engage with yourself around the systems and processes that we're putting in place. Our ask of you is around compliance with the guidance. Please, when you're in your clinical areas and non-clinical areas where you see things that aren't right, we all take responsibility to put them right or to raise them. As I say, we will, as a senior team, we're taking this extremely seriously, and are all aware of the improvements that are required. And I ask of yourselves, please, to take that same approach. There'll be more work coming out, so I know, and thank you to the estates team. They're being put under immense pressure at the moment around how we can use March as an opportunity to at least complete a lot of the estates work, certainly in our ward areas that requires the improvement. So they're under a lot of pressure at the moment, but it's for the right reason. We want an environment that we can be proud of, that we can keep clean, and of course to protect patients as well. Moving on, cyber security was the next area that I just wanted to raise, and people will be aware of the sad situation that Ukraine finds itself in. But off the back of that, there's a heightened awareness or a heightened threat, certainly for the NHS and other organisations in relation to cyber security. So please, again, just a bit of a plea about following good IG and data practices. Be really careful clicking on links, etc., if you're not aware of where emails, etc., have come from. And there's quite a lot of communications coming out as well at the moment to help that and support that. And I believe there's a desktop sort of emergency planning, desktop in planning as well around this. So again, please read the communications that are coming out. If you haven't done your training for a little while, again, perfect opportunities just to refresh. But we all need to be that heightened awareness, really. And just especially when so many emails come through, it's so easy to click on links without maybe really thinking it through, potential consequences. And just a few positives really to end on. I always like to finish on a positive. It seemed quite negative so far today, but yeah, just wanted to call out and thank the theatres team for the innovation work. So you'll have seen through our communications, Theatres Innovation Week. It's actually a fortnight. It started last week and continues this week. So thank you certainly to Simon Luthwaite and the theatre team. And what's great around this is seeing the bottom-up approach. So the team coming up with ideas and working through them, and then evaluating new ways of working, efficiencies or innovation. So certainly it was great. Last week I went, saw some of the demo of some of the robotic kit that's out there nowadays. So as I say, not just thinking about the day-to-day stuff, but thinking about the future and different ways of working. So for those involved, thank you. And as I say, it's carrying on as well this week, and there's different events taking place throughout the week. Other area I just wanted, which I think is a real positive, was the new intranet, Percy, was launched last week. Again, just modern. I don't know if many of you have been exploring it or having a look around it, but certainly far more modern and user friendly to help do our jobs, be able to find people, policies and different documents and that we need to do our jobs, but also as well a better way of sharing communication and sharing information. What's great about this is that you can also access it via an app on your phone. So again, don't necessarily need to be in the trust as well to access some of this. So great piece of work. I know we're asking for feedback on it. That's coming out regularly within the comms. So please do share your feedback. We can only make improvements when we hear off yourselves, off the users. So but yeah, thank you to PMO and the comms team, which I know put a lot of work and effort into this. And then final point from me before we open it up for questions. Again, bit of a plea really. Went out again in comms yesterday about the patient safety questionnaire. Launched as part of the new roles that we've implemented within the trust, our patient safety specialists. So Dr. Sophie, Kirsty Foskett and Lisa Newton, who are our patient safety specialists. But this is a really good benchmark and a sense check of our safety culture within the organisation. So again, really keen to hear people's feedback around how we can make improvements moving forward. So a positive piece of work, but will give us really something to be able to work from and improve. So please do. It's quite long, but it can be done quite quickly. So please do. If you get spare 10 minutes, then please do complete. Okay, that's I think enough from me at this point. Chris, I don't know if anything's come up yet in the chat.
No, I think everyone's been listening intently, Stacey, but no questions so far. So you might want to encourage people. This is people's chance now. You can either stick your hands up and ask a question directly to Stacey, or yeah, if you're a bit shyer but you've got a question, stick it in the chat and I'll ask it on your behalf. So either way, this is your chance while Stacey's here. Has anybody got any questions? Everybody's very relaxed. Nothing.
I always never know quite how to take from that. Is it communication's good, so people feel they're getting answers to the questions that they may have, or is it more negative and people don't feel able to ask questions? There we go. Anybody want to answer that one? Oh.
We got a hand up from Pat Evans. Brilliant. Pat, do you want to put your camera on as well so we can see you?
No, I haven't got my camera working today. Sorry, I'm on my PC, so you'll just have to do without my lovely pretty face looking at you. To answer your question, Stacey, I think communication is good. I don't think there's anything negative, or certainly from my point of view and my team's point of view. And I would hope that that's the same view around the trust.
Thanks, Pat. That's really helpful. Yeah, it may be worth Chris doing something around how the trust feels from a communication. I know we do rely quite heavily on written, and that's not always great and doesn't suit everybody. But if there's different feedback of how we can do things differently, then that would be helpful. I'm waiting for the next hand. How many have we got on the 42-ish?
55.
55 of us. Okay. Any thoughts, anything triggered from the infection control update? Oh, hang on, I think Imran. But yeah, hold that just while Imran asks his. I'd just be keen to hear people's views, reflections around are we having the right conversations, people talking about it, any ideas, etc. So, but yeah, if I bring Imran in first. You're on mute, Imran, sorry.
Yes, sorry. There's been a lot of talk on sort of my colleagues' channels regarding resumption of face-to-face meetings and things. I don't know if you covered it. What's the trust stance on restarting face-to-face meetings?
Yeah, it's on our agenda, Imran. We didn't touch on face-to-face meetings per se at our senior leadership team meeting this morning, but we did start talking around office provision, ability for people to be on site. I think we need to do that piece of work first, because we still have, you know, our meeting rooms, as an example, repurposed into staff rest areas, etc. So I think the first thing we need to do is to enable people that want to be on site, whether that be hybrid working, etc., to do that bit first. Then we relook at the rest of the site. It's also difficult at the moment without the IPC guidance. There is talk potentially of moving to a metre as opposed to 2 metre distancing, which again, when we get that guidance, we need to take that viewpoint and risk assessment across the trust. I would like to start to re-engage some face-to-face, as I think a lot of us would. That's not to say Teams isn't part of our future. I think it's absolutely is, and is brilliant for many different things. For business, isn't it? Teams is really good, and to get a wider audience, which we wouldn't be able to do currently, even on site with the facilities that we've got. We couldn't all be together face to face safely. So yeah, keen to bring that back online as well, Imran. But again, I think we need to, where people to do their jobs, to get them back on site first, and then we'll look to provision space, etc., for face to face.
Thank you.
Thanks, Imran. Looking for other hands.
Stacey, we're out to advert for a couple of new directors. That's not something you've touched upon today. I don't know if you want to talk about that at all.
Yeah, that's good point, Chris. So yeah, I think this is really positive. So last week we put out 2 posts, one for a chief operating officer and one a chief people officer. And as people will know and be aware, Sarah works both with us and the CSU. So she's just 2 days a week with us. We will miss her, but it's a decision that she's made around her future, but gives us an opportunity to look at that role. And certainly I think people wouldn't disagree with what we need to do from a workforce perspective, as well as the health and wellbeing agenda, EDI, etc. The importance of a full-time post, I think, is key. Just to say, which I've said in other forums where I've mentioned this isn't about restructuring the organisation. This is our ability really to tweak some of certainly the senior team portfolios, etc., and strengthen areas that I think, due to COVID and other reasons, we need to move forward with. So both positive appointments. It's not around restructure, so please, we were quite keen within the comms that came out last week to make a point around that, but it will certainly strengthen both our operational with our backlog, etc., but also the importance around workforce and wellbeing. Thanks, Chris. And also to say, I think importantly, they're not necessarily new posts. So just around the investment, they're not new posts that we've created. It's just different ways of working and reviewing the exec team structure has enabled us to do that. So I don't want people to think that we're investing where we struggle to invest in other areas. This is just utilising really our finances in a slightly different way.
before I butted in, you were just going to ask for feedback as well on the infection control piece. I don't know if you want to pick that up again, although we haven't had any more hands come up.
Yeah, please do. Any thoughts, ideas? We're always keen to hear people's ideas as well. There's a couple of rumours. I don't know whether as well, whilst people are still thinking whether to pop their hands up. So the one area that we picked up certainly at managers briefing, and I know has been raised by a few members of staff around drinking in clinical areas. Well, certainly it was outpatients, and it was an area that was highlighted to us on the visit, on the re-inspection. We are not for a minute suggesting people can't drink in clinical areas. It's really important to, you know, keep hydrated and look after yourself. What again isn't new, and it's been well implemented across the NHS, and maybe just we haven't been strict enough in some of the practices that we've put in place. But all we ask is that the drink has a lid on it, so it's not around not being able to have a drink in an area, but it's around making sure it's covered. So again, we're going to make sure as well, just off the back, there's a few rumours, just to get some information, just to cascade out to staff on that. I thought that might trigger a few hands.
It did last week, didn't it?
Yeah. Okay. It doesn't seem, Chris, like we're getting any feedback, but please do, if people have got ideas and maybe just don't feel that they want to do it in such a public forum, then yeah, let myself or one of the team certainly know. Be happy to pick that up with yourselves. Okay, I think I'll close. But yeah, just to say, as always, a huge thank you to everybody. It still remains hard work. You know, with additional challenges now that we've got in play as well. So, but no, huge thank you to you all, and once again, happy International Women's Day. Thanks all.
Bye.